Hello everyone, my name is Dario Vasquez, I am from Belize. This video is about prediabetes, its implications on treatment. I was motivated to do this video because my mother died from diabetes complications 7 years ago, and I want to alert others about this silent killer. Diabetes is one aspect of the metabolic syndrome, and the metabolic syndrome is a cluster of associated diseases that can result in heart disease, glucose intolerance, or even stroke. According to the American Diabetes Association, in 2007, 7.8% of the US population had diabetes, and twice that amount, or about 57 million people, were diagnosed with prediabetes. Prediabetes is indicated by higher than normal glucose levels, but are not yet high enough to be diagnosed as diabetes. Richard Walker is one of those in the 57 million people diagnosed with prediabetes. Today, he will tell us about his condition. Let's meet Richard.
I'm 64 years old and obese at 305 pounds, and I have fat in my blood, which is called triglycerides. My cholesterol and glucose levels are abnormally high. Additionally, I suffer from high blood pressure. The sad part is that I don't feel a thing except fat, and I can see that. It hasn't seemed to affect my family, but they're all very concerned about my health. And if I don't seek professional assistance, it can have serious implications for my health and consequently for my life. I'm lucky that I have a friend in Lori Van Wyckhouse. She's a registered dietitian. She's been teaching diabetics how to manage their disease for years, and she's put her expertise on the internet. It's called NutriTutor.com. She's given me some really good advice. So Lori, what is type 2 diabetes?
Well, when you have diabetes, your body can't move glucose out of the blood fast enough to keep your organs safe. Food is what raises your blood glucose, so every time you eat, the diabetic body struggles to quickly move the glucose out of the blood and into the muscles to make energy.
So prediabetes is just another version of diabetes?
Exactly. Prediabetes, or borderline diabetes, is the beginning of this progressive and very destructive disease. You'll know you have prediabetes when your fasting glucose test result is between 100 and 125.
So, Lori, who's at risk for prediabetes?
Well, we now know that heart and blood vessel diseases are directly linked to generating diabetes, and vice versa. So high blood pressure, cholesterol, and triglyceride problems all play a role, as does being overweight and inactive. Your risk is also increased if you happen to be Hispanic, Latino, Asian, African American, Native Alaskan, American Indian, or a Pacific Islander. Age even plays a role. Americans need to be checked for diabetes by age 45. Your risk is also increased if a blood relative has diabetes, or if you've had a large baby, gestational diabetes, polycystic ovary syndrome, or acanthosis nigricans. So you see, most of us are at risk for diabetes.
So, Lori, what happens if I ignore my prediabetes?
The disease worsens. Diabetes is easy to ignore because you don't feel the damage it's doing to your body until the disease is in its later stages. It's not long, however, before the destruction becomes quite obvious. Blindness, amputation of limbs, heart attacks, strokes, kidney failure, non-healing ulcers. The good news is that early stage diabetes is very treatable, and you can literally turn it around.
How can I turn my prediabetes around?
Well, since lifestyle has a lot to do with generating diabetes, your lifestyle has to change. If you're overweight, begin losing weight now. If you're not physically active, move your body every day. And put your eating back on track by eating lots of plant foods and reducing fat whenever possible. It also helps to use sugar substitutes in place of sugary sweets. By all means, take a diabetes self-management training program. You'll learn to personalize your nutrition and lifestyle strategies so that you can prevent full-blown diabetes. So okay, Richard, are you ready to begin learning at NutriTutor.com?
Richard has been advised to lose weight, follow a meal plan, and do exercise. Let's find out if Richard is following Laurie Van Wyckhouse program.
Following my nutritionist's advice, I'm challenging this condition by changing my lifestyle. Specifically, I'm going to change my eating habits. I've already cut fats and sweets, and I'm eating more plant food like high fiber vegetables and beans and whole grains. I'm also taking omega-3 fish oil, and I'm using meat as a condiment rather than a staple. I'm getting more exercise by riding my bike 4 miles to work and back as many days a week as I can, and I'm taking longer rides on the weekend. Judy and I love to walk, and we go canoeing to get upper body workouts. In addition, I'm taking yoga to help me relax and reduce stress. Finally, I've joined NutriTutor.com to learn more about this silent killer. Learning online is a lot more efficient and convenient than sitting in class, and I'm really impressed with NutriTutor's high quality of education. The lessons are short, easy to consume, and they include handouts and practice exercises. Through NutriTutor.com, I've learned how serious my condition is. I really think that it saved my life.
Diabetes is a dangerous and progressive disease. That is why it is known as the silent killer. Healthy eating and plenty of exercise are ways of avoiding this deadly disease. Diabetes, don't let it sneak up on you.